Okay, today I want to talk to you a little bit about proper hand washing. I want it to be geared a little bit more towards medical professionals, but really this is going to be useful for anybody on their day-to-day life. Now, it may seem kind of obvious and remedial, but the CDC reports that 5 to 10% of all hospital patients will acquire nosocomial infections during their stay. This can be greatly reduced by proper hand washing techniques and practice. So when should you wash your hands? Before preparing food or eating, before providing care to a patient or treating any wounds, and before removing your contact lenses or anything that causes you to touch your face. Also, after preparing food, especially raw meats and raw poultry, after using the restroom, after coughing or sneezing into your hand, after treating wounds or giving care to a sick person, and after handling garbage and or any household chemicals. Alright, so what is the proper procedure? You should wet your hands with running water. Apply soap and lather your hands by rubbing them together. Be sure to get the backs of your hands between your fingers and under your fingernails. You should scrub your hands for at least 20 seconds. Rinse until no soap remains. Dry your hands with a paper towel, and if possible, use a towel or your elbow to turn off the water. Now, you may find yourself in a situation where you don't have access to running water or soap. Now, as an alternative, you may choose to use hand sanitizer. An appropriate alcohol-based hand sanitizer should be at least 60% of alcohol per volume. The benefits of hand sanitizers are they can easily be carried with you anywhere, and they are very effective at reducing the number of microbes on your hands. However, hand sanitizers will not be effective against all microorganisms. Though they do reduce the total number of microbes, they will not kill all the types of cells that are on your hands. In addition, they will not remove the cellular debris. So what microbes do remain will then use those debris as a nutrient source, and they will therefore proliferate much more quickly. For this reason, hand sanitizer should never be used as a substitute for washing your hands with soap and water, just in addition, in case you are not able to do so. Now this kind of brings me to my next point. Here in the past few years, antibacterial soap has become extremely popular. However, it's actually no more effective at removing germs than any normal soap and water. Now, this isn't necessarily because the antiseptic agents that are inside the soap aren't capable of killing bacteria. It's just that they're not going to be on your hand long enough for them to actually do any good. And really, this is just going to cause a risk of selecting for bacteria that are resistant to the specific antiseptic agent. So my recommendation would be to use good normal hand washing techniques on a regular basis and augment that with the use of alcohol-based hand sanitizers. Now, as I said at the beginning, this may all seem a little bit remedial. You know, we've all been washing our hands since we were children. But the facts are, nosocomial infections, that is, hospital-acquired infections, are a very serious problem. As healthcare professionals, we have a responsibility not only to protect ourselves, but to protect our patients. Okay, so thank you for your time, guys. I appreciate it. And remember, if you ever find yourself in a situation where you're given the option to act or to not act, it is almost always better to act. Thank you.